Welcome back to Made to Be Whole. Stay tuned for an update on babesiosis.
Made to be Whole is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Be Whole. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing.
This is Krista Michener. Welcome back. We're going to talk this week a little more about babesiosis, which is the condition of being infected by the Babesia parasite. A little more about the treatment, some things that are changing in the treatment world, symptoms, just everything you need to know to be attuned to where you might be in your treatment, if it's affecting you or someone else, changes that are available that might not have been when you first became aware of the condition. So as a review, babesiosis is an intra-erythrocytic parasite. So intra meaning inside, like your intrastates are roads are the ones that are just in a state versus the interstate highways that go between states. And then the erythrocyte is the red blood cell. So I always start with just the basics of think about what your red blood cells do when they are healthy. A healthy red blood cell carries oxygen to the rest of your body. If you have a percentage of those red blood cells that have been hijacked by a parasite, you are not going to feel as well. You are going to be more tired. Now, remember, because it is inside the red blood cells, you can have symptoms wherever blood flows. So that includes your brain. There are small blood vessels that innervate the brain and are perfusing it, and you can have a lot of cognitive symptoms. I have mentioned before in the podcast, but to me, Babesia embodies heaviness, brain fog, fatigue, heaviness in your legs, just everything is slow and sluggish and difficult to do. Anecdotally, I've mentioned that I recently re-upped my Babesia treatment because I noticed I was starting to have to lie down after dinner and rest. I couldn't support my body into the evening. I had to restart. We had to just recently restart my husband's treatment for similar reasons. He just kept saying to me, I just feel weak. It's hard to even sit next to our son and do things at night. And I saw him start to drag. Well, we restarted treatment, and because treatment puts a magnifying glass on your symptoms, those symptoms can become worse before they become better. So he restarted atovaquone just last night, and I watched him this morning. His legs are just dragging. I mean, they just look heavy. I can tell he's struggling, and I know that feeling, and I hate it. Some myths about Babesia treatment. I did some training, a little lunch meeting with someone from an herb company who has a lot of herbal protocols for these infections, and they have some really good products. But one thing she said to me was that she always starts with Babesia treatment because it's just so easy. And I thought, you probably really don't know a lot about Babesia, or you think you're treating it and the residual symptoms you're attributing to other infections are because of that. Because again, I like to think of the math of it. So if it's inside the red blood cells, what is the life cycle of a red blood cell? At least 4 months. Some estimate a little longer. So can you treat less than a life cycle of the red blood cell and then have healthy blood cells? No. And in my experience, one life cycle of the red blood cell is not sufficient, because if you look at any other thing that has different life phases, so you have the actual intra-erythrocytic parasite, but then also as those red blood cells die, you have some in the extracellular space. We know that particularly with Babesia otocoeli, that there are fibrin nests that entrap this. So we have to clear these nests too, because one of their favorite places to sequester is the brain. you have to be very gentle. You can't do any sort of mass die-off and not really make people very, very sick. So you have to do it in phases. You have to be very, very gentle. Treatments, we've talked about it before. I'll do a little summary and then some updates. I really like using atovaquone, which is a liquid. It is helpful for multiple different reasons. Because it's a liquid, I can start low and titrate up slowly. It binds specifically to the parasite, so I'm not going to have cross-herxing from other infections. Because of that also, any of the die-off is Babesia related, so it helps me get a really clear picture of what the patient's actual Babesia symptoms are versus other infections. I call it, and this is a very pedantic description, but I call it the vacuum cleaner, where it's just starting going around and getting everything that's kind of hanging out, easily available in that extracellular space because red blood cells have died or different stages of their life cycle, the stuff that's a little easier to get. We then add things that go into the red blood cells. For a long time, primaquine was the only option. Then tafenoquine became available, and it was available first as Crintafel, these 150 milligram tablets. Those were taken off the market. We don't know why. And then Arakota became available. And I have a lot of patients who are taking Arakota. So if you're one of them, listen up, because there are some changes we're going to be reaching out to you about. But Arakota is soon not going to be available anymore. But there is the Australian version of Arakota, which is the exact same medication, tafenoquine 100 milligram tablets, same everything, different label. It's called Kodatef, Kodatef. 100 milligram tablets. So this is important because there's only one pharmacy that's going to be licensed to dispense it. That is InfuServe America in Florida. They are national, so they can ship anywhere in the United States. The company kind of gave them those rights because they also agreed not to price gouge. They're going to keep the prices the same. So that is, as of today, when I spoke to someone, $244 for 16 tablets. But remember, these tablets are not taken daily. That sounds like a lot if you haven't already been taking this medication, but it's a fair price and that you can't find it cheaper anywhere else. So any of you who are taking tafenoquine from me or elsewhere, you need to contact your provider and tell them, once you get the notice from your Walgreens or wherever that they can't get Arakota for you anymore, that you need your prescription sent to InfuServe America in Florida. They can do it either as the generic tafenoquine 100 milligrams or name brand Kodatef, and it comes in the same boxed package of 16 tablets, but they can dispense different amounts for you. Other things that I found super useful in the treatment of babesiosis, cryptolepis. Cryptolepis is an herb. You can find it on our website if it's not something you're already taking. I like, because it's a tincture, to have patients, again, start with a very small dose and inch their way up. If you have die-off at a drop, you shouldn't be going straight to a dropper full. You should start with a drop twice a day, and then I typically recommend that people work up to a dropper full twice a day. But there is no race to get there. If you're tolerating it well and every few days you want to go out by an extra drop, that's fine. But if you're having severe die-off at a drop or 2 drops, you need to hang there until you're feeling much, much better. Because if you're having die-off, it is doing something therapeutic. The goal is not to take a certain amount of something. The goal is for you to get well and stay well, and for your treatment to be sustainable. So don't ever feel bad if it's taking a long time to get there. That could be because of multiple different things. It could be, first of all, because of how infected you are. You may have a very, very high load and you're killing off more than other people, and it's just rough. So that's something that we can't really quantify, but it's not because you're weak or you're a wimp. It could be because your immune system is kind of beat up from chronic infections, toxins, other things, and it's a little harder of a ride. That's why always doing things that support the immune system are super, super important. But don't give up if it's quote unquote not working and it's still hard. It's okay if it's hard, because the alternative is doing nothing. And I can guarantee that if you do nothing, it will not get better on its own, unfortunately. Now, you may get to the point where you say, I could live like this. This isn't so bad. And that may be true. But what if, because the infection keeps growing, it gets worse and then is harder to treat down the road? You have to balance things out. But I really think ignoring these infections is a bad idea. You can choose how aggressively to tackle it and with what modalities, but ignoring them is a bad idea. Other things that are excellent for the treatment of babesiosis, Artemisia or Artemisian, which is wormwood. I really like Dr. Zhang's because it's very potent and very pure. It's also on our website. He has it under the name RDM, very potent. I recommend, again, the bottle says to take 3 times a day, but most of the time you're going to be better off starting with 1 a day. When you're tolerating that, go to 2 a day, and then you can work up to 3 a day. That can be excellent. We mentioned these fiber nests that like to sequester the parasite. So you have to do things to break up those nests. With anything that breaks up nests or biofilms, I strongly, strongly recommend that you add it after you have enough of your kill on board, because if you start busting up nests and you don't have enough of these anti-babesial medications on board, it's like kicking a hornet's nest without anything to kill the hornets. You're just going to stir things up, release more infection, and feel worse. But if you do it in a graduated manner, you're going to feel better. And as those nests break up, you're going to have sufficient antimicrobial stuff on board to take care of it. With lumbrokinase, which is my preferred agent for this, there are a couple of good brands out there, but honestly, the only one with research behind it is Baluchi lumbrokinase. It's now carried by Research Nutritionals. You can find it on our website also, but it's very, very potent. It's got a lot of good data. They recently had a shortage and were out for a few months. And I had multiple patients tell me, even though they switched to what was supposedly an equivalent dose from another brand, they could feel the difference, that it wasn't doing as much. I really felt like when I cognition, it took a couple of weeks, but I could feel like things were working differently in my head. And I remember telling my husband, I feel like blood is flowing places that it hasn't flowed for a long time. You can alternatively, or in addition to lumbrokinase, use nanokinase. It's not quite as potent. It can also help. The other benefits of those enzymes, though, is they're really great for circulation and for blood flow. So people who have had cardiac issues, have clogged arteries, this could be a useful part of your treatment under the direction of a healthcare professional. Because remember, if you start these and you feel worse, my personal experience is it's likely because it's releasing other things. So say you have Babesia and Bartonella, you are doing your anti-babesial things, you add lumbrokinase, but you don't have anything great on board for the Bartonella, because it can also break up those Bartonella biofilms. And we know that fibrin deposits are part of that infection too. You could be releasing some Bartonella. So you're very graduated in what you do. And whenever you're adding treatment, my strong recommendation is that you add one thing at a time so that you have good data about what's causing what. So it's a little different with things like vitamins. It's fine if you add a couple of different vitamins, one after another in successive days, but for anything that is part of your treatment that could actually be killing something or contributing to treatment success, as far as biofilms, fibrin deposits, that sort of thing, I strongly recommend waiting at least a week between changes so that you can gather data on how the last change went before you add the next change. Sometimes people add something and they can tell day one, oh, this is really doing something. But sometimes you get this little false sense of security. You take something, you think, I'm doing fine, this isn't bad. And then on day 3, you really start to feel it. But typically, if that's going to happen, it's going to happen within that first week in my experience. So separating dose increases and adding treatments by at least a week is most of the time warranted in the context of these chronic infections. Other things that can be helpful for treatment, I do use allicin for everyone who will take it, ALLICIN, just because it's got great antimicrobial benefits. It has effects against Babesia, but also BART, Lyme, viruses. It's just got so many great benefits. I think anyone who can tolerate it should include it in their treatment. And it's something that I plan on taking in perpetuity. I've mentioned before, but our family, since we've been taking these higher doses of it, we really have not struggled at all with cold, flu, the acute viral stuff that usually comes through seasonally. We have been spared mercifully from that. So, also looking at the symptoms of Babesia and what you can do to offset those. Obviously, the most important thing is to clear the infection that's causing the symptoms, but we still want to do things on an interim basis so that you're not suffering as much. One thing that I've found very helpful with the brain fog, even brain fog associated with infection, is a supplement called BDNF Essentials from Research Nutritionals. So BDNF stands for brain-derived neurotropic factor. I've referenced it before. One of the best things you can do to naturally boost BDNF production is activity, not sitting for extended periods of time. That's not good. Even if you're getting up every 60 to 90 minutes and all you have it in you is to walk around your house a few times, that still is beneficial. And I really like for people to incorporate movement into their treatment. We've talked about the vibration plate. We've talked about other things you can do that are gentle. But this supplement, BDNF Essentials, is really, really excellent. It has choline, it has lion's mane, it has other things, but that are formulated to cross the blood-brain barrier and to increase BDNF. And I have been very impressed of the number of Babesia patients that I've had who have had improvements in their brain fog with BDNF Essentials. You take 2 capsules twice a day. It's a great product. They do a great job researching their products, using quality ingredients, all of those things that I trust and find are important. As far as the heaviness in your limbs, so other things that can contribute to that are impaired blood flow, which can be obviously if you have an intraerythrocytic infection or you've got a vascular infection or you have fibrin deposits, that's not going to help your blood flow. But also increasing nitric oxide levels can help blood flow. So anything you can do to increase your nitric oxide levels can also be helpful symptomatically. I've mentioned a few of the products that I've found to be the most helpful, and they also have a lot of research, which I think is important. That would be Vinia, VINIA, and then also Neo 40, which is formulated specifically for increasing nitric oxide. And I have had patients have symptomatic improvement, not just with heaviness, but even with things like heart palpitations. If you have heart palpitations and your heart's been checked out and there's nothing structurally wrong with it, then you've got to look at what might be causing those symptoms. And I would not for a minute buy the line of BS that most of my patients get is that it's just anxiety. That's usually if the medical system can't figure out what's wrong, it's anxiety and it's your fault. So get over it. If that were the case, why would it be that my patient could start Neo 40 and their heart palpitations would resolve? If that's the case, why would treating an infection that obviously affects blood flow improve those symptoms? So those are 2 things that are very safe for most people, Neo 40 and Vinia, that can help aid circulation by increasing blood flow. The Vinia is a long-acting form of resveratrol, and resveratrol does have antimicrobial properties too, so it can also be beneficial in the treatment of infection. Because of that, you could have a little bit of die-off. I have found personally, though, that I did much better with the Vinia than I did with regular resveratrol. Most resveratrol peaks in 15 to 20 minutes and is out of you, but Vinia is sustained. It's a 12-hour release. So because of that, I felt like the die-off was as intense, and I enjoyed what it did for me. Other things that I've found helpful, I mentioned before IV Procaine in the context of chronic pain, that we offer that at our office, but it helps inflammation generally. And I stumbled into its benefits on a experienced them firsthand almost by accident, which I'm really grateful for. The nurses at my office had mixed it up for a patient, and then that patient had really, really difficult veins that they weren't able to access, and the medication had been mixed. So they said, Krista, do you want it? It will go bad. I said, sure, hook me up. So they hooked me up, and I was absolutely amazed that within that first session, I could feel the inflammation in my brain decreasing, and I could feel my hearing improve and my ears kind of pop and open up. That lasted for like a few days, and then I've been doing it weekly, and I'm finally to the full dose, and I'm going to start backing off to see how long I can go in between and still maintain those benefits. But it's been an absolute game changer. And there is a lot of evidence that a lot of the emotional, mental illness, cognitive, neurological syndromes that people suffer from are from neurological inflammation. And as we've said, the brain is really, really hard to get to. But IV procaine, which is a combination of saline, sodium bicarbonate to alkalize your body, and then small giving intravenously is going to be more successful getting there. There are side effects from anything. It's not for everyone. Most people tolerate it well. If you feel a little funny, we can always turn down the rate. Now, when I have the actual infusion, I do feel a little funny. I feel a little woozy, a little dizzy, but I can tell what's going on in my head. If if the amount of pressure in my head is changing, I'm gonna be off balance for a little while. I adjust to those pressure changes. So I'm always thinking through when something happens, not, "Oh, this is a side effect, this is something bad." I'm trying to analyze what could be causing me to feel this way. I know that I feel more relaxed. I know that my ears clear. I know that I feel pressure relieving. So if I'm feeling a little dizziness, this is my body adjusting to it. One of my sons, I decided to start having it do with me as well. He doesn't really notice the benefits within the session, but my husband and I both have noticed significant improvement in emotional regulation, that the depression, despair, anxiety is still a struggle, but it's much less profound. We feel like it's really taken the bottom and raised it up so that our baseline is higher, and he's able to tolerate stress more and just manage, because for this particular kid, the emotional symptoms of the illness have been really, really difficult. Again, if you're giving something anti-inflammatory and someone depression dramatically improves, that's a pretty good sign that the depression isn't because of willpower or lack of a positive mental attitude or anything like that, that there's something inflammatory that's driving those symptoms. So I have been super, super happy with the effects of procaine. The other thing I've started in the last month that I feel like I'm starting to see benefits from is the plasmalogen precursors that I've mentioned, the fatty acids that are designed basically to help repair your myelin sheath. Your nerves have that myelin sheath, but there's a fatty coating that help them communicate. Those get degraded over the time, and we know that infection can make that worse. It's a lot of stuff. It's a lot of stuff, and it's a lot of time, and it's a lot of expense, and you can't do it all at once. I'm talking to you about all the things that I've tried and found hopeful over a 3 to 4 year journey with my own personal care, and self-care, spiritual care, exercise. Those things have all played a big part. Sleep have played a big part. There's not a magic bullet, but there is hope. There really, really is hope. Some people get very frustrated if they don't see the benefits right away, which I completely get. I can 100% relate to why someone would say, I don't feel good. This treatment is not making me feel better. It's making me feel worse. I'm done. But I also know that the alternative isn't pleasant. And I've mentioned the number of people who come to my office with later stage disease who have a lot of neurodegenerative conditions and things that are much, much harder to treat. You are going to be much better served by keeping Humpty Dumpty from falling off the wall than putting Humpty Dumpty back together again. We can put Humpty Dumpty back together again, but it's a lot harder. And if you can stick through it and say, okay, this stinks, but it means it's working. We do everything we can to offset the treatment effects by making sure your immune system's taken care of, you're getting good sleep, we replace missing nutrients, we take care of hormones if they're out of whack, we do all these different pieces of the puzzle, you can get better. It's very tempting to say, well, I'm going to try hormones first. And if hormones don't work, then I will stop those and then I will do this thing, because we want this monocausal model. We want to find one thing that we can address and fix, and everything is better. But very, very rarely is that the case. Occasionally it is, but most of the time, by the time people see me, there's a lot more going on. And if you don't fix your hormones, your immune system's not going to accept treatment and function the best it can. If you have nutrient deficiencies, we can treat these infections, but your body's not going to have the reserve to take care of that and put together your parts in a healthy way, and you're not going to have energy, and you're going to have more pain. So it's a layered approach, and the best thing that you can do for your health is to acknowledge that it's hard, but that you're worth it, that it takes time, but it is possible. We were all made to be whole. That's the whole theme of this podcast and of what I do. I would love to say that, yes, everyone who comes, we can put back together in perfect shape and there won't be long-term complications. Some people are very, very sick. There's some people that I'm very concerned by how far along they are in their disease progress, how much we can do. We know we can stop the progress, but I worry about how much we can get back and if they have it in them to go through that. But there can always be some improvement, and the sooner you act, the more you can prevent and the more you're going to be able to regain. And it is hard, but it is worth it. When I have had these days where I feel the inflammation in my head going away, and I don't worry because my head's not inflamed, and I can just make decisions like a normal person and not think everything is a difficult decision, and just lay down and go to sleep without stuff stewing in my head. And I can wake up and look objectively at what needs done to the day and just decide what to do it, instead of having this emotional attachment, which I realize largely has been driven by inflammation, because the inflammation goes away and it's not hard to feel joy. It's not hard to make decisions. It's really not that big of a deal. So please always have hope. If you tried before, try again. Try something different. Be willing to go with the layered approach, because that's what's going to get you there. It's not going to be one thing that takes care of it. You can read all of the studies and blogs and social media posts about, oh, if you have Babesia, you just need to take wormwood. It's great at killing Babesia. Remember, it is, but we also have to get to where Babesia is hidden. There's a lot more nuance beyond what happens in a petri dish or in a laboratory than what happens in your body and all of the things that are protecting it. So if you have any questions you would like addressed about babesiosis, send us a question to the podcast line. I will throw out one more thing before I wrap up that I didn't mention, and that is ivermectin, which I think is hilarious, because before the COVID pandemic, most people hadn't even heard of it. It's been around for a long time. It's safe. It's an antiparasitic. It can be a great augmentation for Babesia treatment. I don't find that it works by itself, because again, you're looking at all of these different places we have to get. But I have some patients who really feel like they turn a corner when we add it to their treatment for a period of time. It is dosed by weight. I strongly recommend not getting the stuff from Tractor Supply Company, even though it's cheap. I suggest finding a provider who can help you get it dosed by weight and have it compounded at a compounding pharmacy. Those places use pure pharmaceutical grade ingredients. We know where they've been. We know the potency's right. We can get it dosed by weight and dosed into a capsule. That's just a single capsule for the day. What's available through your regular pharmacy are 3 milligram tablets. So for most people, because we're dosing by weight, they would have to be taking 4, 5, 6 or more tablets to get the therapeutic dose. Post-COVID, because it's become controversial, nobody's insurance is gonna cover it, so don't even bother. It's not gonna cover it. Half of the pharmacies won't even fill it, and the expense adds up so quickly because of the number of tablets that you have to make. I think it's more cost effective for most people just to have it compounded because we know where it's coming from. We can get you the right dose. It's fewer tablets, and we can get you better faster. Send me any questions that you have, and remember to have hope because you were made to be whole.
Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.